Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I have a guest who's been on here before. His name is Josh Davis, and he's the owner of TriStar Strength and Rehabilitation. And the thing about Josh is, besides he's a great guy, is he's a bona fide physical therapist whose focus is really on training. So when you get somebody like a very experienced physical therapist who knows anatomy, physiology, and has been doing this for a long time, with the goal now of, not working in hospital settings or anything, but of really conditioning people in the right way. I've always said that maybe besides nutrition, number 2 in your list of things you need to be thinking about is exercise. And he's a bona fide expert in all this. He's done wonders for a lot of my patients. You have a great reputation. I've never sent a patient out there that didn't absolutely love you and continue to follow up with you.
Love it.
You're doing a great thing. I like the fact that you're independent, and you're not working. You're working for yourself. You're not working for a big system or anything like that with restraints. So you can kind of do what you want to do, and your reputation is just built over the years. I've participated in some of your clinics and your grand opening, and you've done that with ours. So we've had deadlift clinics and all this, but it's so good to have you here today. I really wanted to pick your brain on longevity, which I consider myself a longevity doctor, and your ideas about relationship of exercise to longevity, a lot of biohacking that goes on. So tell me first about your facility now.
Yeah, so right now we're in Boones Creek. So we got about a 2,000 square foot facility. We got a couple treatment rooms. We've got a couple squat racks, which you normally don't find in PT clinics, but we've got even more goodies. We've got a Kaiser air pneumatic machine that we can work on rotational power with baseball players, older adults who need to move their thoracic spine, because everybody typically moves up and down, just sagittal planes. We need to be rotational for longevity purposes. Because if I'm going to pick up my 3-year-old, or 2-year-old son, my wife will kill me if I said 3. I don't need to, age him anymore. But, typically I'm not going to just perfect form deadlift, pick him up. I'm going to pick him up and I'm going to throw him, catch him, all that kind of stuff. So, man, I mean, we're actually trying to move up a little bit and get a bigger facility here soon. So we're shooting for like maybe summer or fall to have about a 6,000 square foot facility.
You're growing for sure. I didn't know about that rotational machine because you're exactly right. When somebody comes to me with an injury, whether it's a shoulder or back, it's usually a rotational type
100%.
Injury, and
100%.
we never think about that.
Yep.
So how does this machine work?
Yeah, so it runs off air. So a traditional like functional trainer has like a weight stack, and it just runs off a series of pulleys. And most of the time it's like a 2-to-1 pulley to cable ratio. If it's even better, then it's 1-to-1 ratio. This runs off just pneumatic air. So we've got an air compressor set up. So whatever pressure you put back, it's going to give it to you on the eccentric as well. So like, a lot of times with my golfers, baseball players, softball players, pickleball, like everything, we're really working in that rotational plane, that transverse plane, which is nice being a physical therapist and a strength coach. We blend the two so we know how to avoid like spondies and spinal fractures and, really get that rotational plane, dialed in. But then we do med ball throws against the wall. We try to like get a radar gun and like actually time it. Because we're all about metrics, as you are. So we've got our force plates there. Everybody goes through a actual performance assessment and a physical therapy assessment before they work with us to get cleared. And then from there, we build out an athlete profile, and we just track these metrics, like with the mid-thigh pull, with counter movement jumps. Everybody jumps, no matter what age you are, unless you have an injury, right? We're going to make an ACL.
I love it.
But we have a lot of 60 and up people, jumping on the force plates, getting their reactive strength index, which is their quickness. So type 2 muscle fibers, how quickly they can put force into the ground, reverse it. Then we track force. So we've got basically a speed component, strength component, and then a jump component for power.
I love the fact that you want people to jump. My goal as a 70-year-old guy, I'm actually doing some of it. If you look at my jump box over there.
Love it.
But also, I have kind of a bad back.
Yep.
Everybody that listens to my podcast knows about that.
Yep.
But I've learned to sprint a little bit, because I think that's so important because it gets the posterior muscles. You know,
100%.
when you bike, I bike a lot too, but it all seems like it's overdevelopment of my quads, and my butt's not involved in cycling too much. So if you can sprint, whether it be, you know, it's not going to be that fast for me, but in jumping, have you seen any 70-year-old guys that can dunk a basketball?
Not in person, I will say that, but I'm doing my best to try to change that in the area.
Michael Jordan dunked at 60.
Yep.
And I think one of the other NBA players. But you know, most people, I used to be able to dunk a basketball in college, but, you know, now I couldn't even touch the net probably.
Yeah.
So we lose some of those fast twitch fibers
100%.
as we age.
Yep. Well, and, you know, talking about longevity, I'm 32. And it's funny, my post yesterday on social media was talking about how, like, the difference between working out and training. So we don't just work out, and I put in quotes, right? Because working out to me is just getting sweaty, getting a pump if you're trying to, you know, aesthetically get in better shape. We train because we're training for a purpose.
Function.
Right. Yes. And
avoid injuries.
Yeah. Well, and, you know, for me, it's like I refuse for my son to have to throw with another person. Right. Like if I'm sitting there, I'm not going to be like, my shoulder's killing me, I'm not going to throw. Sorry, son. And then I'm not going to have to somebody else carry him at Disney.
I love that.
You know,
you put out that quote. I put out a quote the other day that you'll probably like. It goes like this. And actually, one of my patients told me this, and I told her I'm going to use this quote because I love it. She said, "You can fool other people. You could even fool yourself. You cannot fool your body."
100% agree.
Have you ever heard that quote?
No, I haven't, but I mean, it makes complete sense.
That's such a great quote because you can, but eventually your body, it's going to come out and tell on you.
100%.
If you're not training the right way, or if you think you're in shape, but you can't fool your body. It will come out in the form of an injury or a disease, and you have to take care of it, especially as you age, which is what we're going to talk about. Longevity. Really, what kind of exercises do you need to do? Let me ask you one thing. In an older population like myself, I call me the pickleball generation.
Oh, no,
we're all now playing pickleball. I was a tennis player. Now I'm a pickleball player.
Yeah, for sure.
You know, I went from I played basketball, tennis, then I cycled, and now I'm a pickleball player, trying to not get injured. We see so many injuries on the pickleball court. It's unbelievable. What is the most common injury you see in baby boomers my age?
I would say low back, just general low back pain, right? Been fighting gravity for 70 plus years.
And everybody gets those degenerative discs.
100%.
Everybody.
Well, and I mean, I'm sure I have some of that at 32 because I've pushed my body and I, you know, intend on to continue push it. But yeah, I mean, I would say low back pain, knees are something super common, shoulder injuries. And as far as specifics, I mean, it's typical, just aches and pains. But it's something that if we know what the goal is going in, so say you want to be able to play pickleball 4 times a week in my experience, people play pickleball for 5 hours. You know what I mean?
Way too much.
Yeah,
way
I
too
totally
long.
agree.
Because you get hooked on it.
You do.
And it's 2.5 hours, and you're really sore. And the next day, you're even more sore.
100%. Well, and I think from a longevity perspective, that's where whenever you come in for an assessment, we break down goals, right? Like we take the time to sit down and I'll be like, okay, we hit a home run in month 1, pain is down. What are we pushing for month 2, which is we call our navigate phase. So we're working around it, and then we start going the dominate phase in month 3. So we do 3-month plan of cares, and we do that for a reason so that we can get pain to go away, and then we start slowly transitioning towards performance. But now that performance is different for everybody. But we have like certain pillars, right? So for pickleball, for instance, you need to be able to rotate, right? So if you're going to backhand, forehand,
lateral movements,
100%. You need to be able to go forward, stop on a dime, backpedal. Backpedaling is something as we age, we don't have toes on the back of our feet, right? And typically when people fall, they're going to fall backwards.
Yeah, one of my good friends broke both of his wrists backpedaling in pickleball. That's a 100%. Major thing to try to avoid is too much backpedaling.
Yep.
You don't see much lobbing in pickleball, but when you do, if you're backpedaling, you got to be careful. That side-to-side movement, too, is tough on knees.
It is.
Really tough on knees, I found.
Well, and that's something that we work up to. So thinking about this longevity piece like we're talking about today is we want to build up to those points. So ways that we can, for instance, break down one movement. So we'll talk about squat first. So we want to limit range of motion. So I typically go from the top down So like we'll start at the top of the squat, standing up, go down to like a box, right? So you can feel that tactile cueing on your butt. And then we lower the box, get you closer to the ground. But with that, we work on tempos. So slow on the way down, pause on the box, don't sit, explode on the way up. So now we're getting the slow loading of muscle, tendon, which is great for tendon health. We're getting the hypertrophy, which is breaking down the tissue on that, which is just building muscle, is what that means. And we're trying to build that up. And it's also a good motor control movement. So if you go slow, you have to do it correctly, right? But if you go fast, that's whenever stuff turns sideways and you start getting, you know, all these crazy little bit of valgus in the knees going in, and it's when you get hurt. So then we move that, you know, further. We'll go full range, then we'll start loading it up a little bit more. Maybe we'll move to a deadlift for more hip hinge and posterior chain. So we've got kind of big buckets that we work with as far as longevity goes, as far as movements.
So as far as prevention of knee injuries, say for a pickleball player, what would be the most important exercise you can do?
So I would say anything that we can do full range and single leg. So the first exercise to me comes to mind is, if we're going forward and back, is a reverse lunge to start. So the reason I like a reverse lunge, and y'all can do this at home, you know, if you're watching this, is step back and you have to keep your front shin vertical. So don't go over the toe. There's nothing wrong with going over the toe. I just want to say that you're not going to get.
You've read the knees over toe guy.
There's nothing wrong with it unless you're symptomatic. Right. So if you're having knee pain, that's going to flare it up. So that's why we start with a reverse lunge, and then we just start loading it. So then once the knee is feeling good, we go range of motion, start, you know, decreasing or increasing range of motion, lowering your height off the ground. Then we start going forward. So now we're loading the knee, letting the knee travel over the toe. And then we just start loading it. Like my baseball players and even my older adults, we've got a safety squat bar. Have you heard of one of those before?
Where you catch the bar?
So this one, it's just like a big pad. It almost looks like a neck brace, for lack of a better term, but it's got a pad here, and a pad on your back, and it's got these handles. So the bar basically just sits on your back. You don't have to hold on to it. But I typically shoot for 2 times body weight on single leg movements.
Single leg movements are hard.
They very much are.
Single leg squat is hard.
Well, and it's one of those things which, you know, the back leg is on the ground, and it's a split squat in that instance. But whenever we're loading it that heavy, you have to brace your core, you have to engage your lats, you have to breathe properly. It turns into a full body movement. But then we think about, how does that look for longevity? If you can do that 2 times your body weight, even 1 times your body weight, you can get up off the ground if you practice that movement.
Without using your hands.
100%. That's our gold standard. And that's what I actually have a lot of my older adults practice during the week, because we do online programming in addition to their one-on-one sessions. And it's, you know, we're practicing that and we're trying to progress it, because there's ways you can break a movement down, like we talked about the squat. Same thing with practicing that movement.
And when I turned 70, I did a podcast that night, and I demonstrated how to get up from a seated position without using my hands. And I did it in 2 ways. One's, you know, the easier way, where you cross your legs and get up. The other one was from a complete, you know, frog leg position. And I still can do it, but I take 1 step backwards to kind of steady myself. Notice a 9 out of 10. A 10 out of 10 is just popping straight up without your using anything as far as a backward balance move. So you're saying that lunges are really, you consider that a single leg exercise, and that probably is a better way to start out than a squat?
Well, I think it depends on the case, right? So if it's somebody that has knee pain, we'll start with the squat, because we can load both legs, right? And we'll do that on the force plates so we can see the weight shift. So where the standing on the plates, we can see, okay, you're favoring the left side. I mean, I can see it. But as far as biofeedback in the moment, it's like you're shifting, you know, 2 out of 3 reps, you were 17% on the left side, which means the right side is probably the one that's hurting, because your body's trying to go away from it. So I'll be like, shift over, you know, just a little bit. And then typically everybody overcompensates and goes 17% the other way. And I'm like, now find the middle ground. So it's something that we use technology as a training tool, not just a testing tool. But yeah, I mean, lunges, they're a gold standard. Squats, deadlifts, or hip hinges. Hip hinges sound a little bit less scary than a deadlift. But then we go overhead press, a bench press of some sort, so a horizontal press, and then a vertical push and vertical pull. So now we're talking like pull-ups, you know, overhead press, stuff like that. That's kind of our big buckets. And then we start, again, this kind of spider webs out. So that's strength. Now we go into power. The same movements apply. It's just the intent and speed in which you do so. So you can do a squat and train for power, strength, and hypertrophy. It just depends on what rep range, what tempo you use, what weight you use, how many reps you do, how many sets. And that's where the strength coach side of what we do really comes into play.
Do you try to get them to sprint?
Yes, as much as I can. Everybody, like especially my baseball players, for instance, they're sprinting at least 2 or 3 times. I'm sprinting 2 or 3 times
What about
a
your
week.
old people? Do you get them to sprint?
I do, and a lot of that it depends on their goals, right? Now, if we're going for longevity and they're able to do so, then we'll hammer it as much as we can. But you've also got to think it is a systemically taxing movement.
It is.
So you have to recover. And then if you're throwing, strength training and power training on top of it, that's where the expertise comes in of, okay, do you need 2 days rest after your sprint days? Well, then how many days can you work out a week?
Yep.
Do you have access to these things? But sprints, you need 0 equipment.
I know. Sprints should be easy. When you were a kid, you could go out and run
100%.
as fast. You could fall, not get hurt.
Yeah.
As an older adult, I think it's really important because I see most people that are old, like my age, they're very underdeveloped in their butts.
Yep.
And, it looks bad, really. And I hate to watch an old person jog. I just think, why don't you just walk?
At that
because
point,
your jogging is just killing your joints.
Yep.
Just walk fast, walk up hills. I'm considering getting myself a backward treadmill that has no motor on it.
Self-propelled.
Have you seen those?
Yep.
They're kind of curved a little bit.
Super good.
Do you like those?
Yeah. We're going to have one at the new facility.
I can't wait to see that because I'm really thinking about getting one.
Yeah, and they're very good. Now, the thing with the curved treadmills and the self-propelled is you've got to have your running form dialed in, or it's like a hamster on a wheel. Like it'll get away from you pretty quick because once you start exerting that force, it just keeps going. And it'll start slowing down, obviously, if you put resistance on it. So we typically start with ground-based sprinting first, and we start with heels, and we start with build-ups. So what I mean by that is like, a little bit of an incline, doesn't have to be like a straight up driveway, anything like that. But we'll start with each step. So you start with the first step at like 10% of a full out sprint. So it's basically a jog.
Yeah.
Each step, you're trying to increase acceleration by like, and I know I say 10%, it's hard to conceptualize, but you just slowly start to speed up, and we limit the distance so that you never reach top speed. And we work on that for, for weeks, maybe a month, feeling good. Then we start stretching that out, and we take away the build-ups, and now we just set a percentage on the sprint, but we go shorter distance.
Do you start timing people to see if they improve?
We have to.
Even older people.
100%. Yeah, because here's the thing, is if we're not measuring it, then how do we know we're progressing?
Exactly right.
And that's where our athlete profiles and our sports science data that we build out from the strength conditioning side comes directly. So you were talking about glute strength in older adults. That's something we test directly with manual muscle testing. But we have a dynamometer that measures in newtons. So like every person will come in, we'll test monthly. And that's something we'll talk about here later. We've got like a 6-week challenge as far as longevity goes. We can talk about it a little bit later. But that's something when you come in the first day, we're going to get glute strength. We're going to get hamstring strength. And then we look at a quad to hamstring ratio. Like you talked about, typically everybody is flipped from quad. They're more quad dominant than hamstring.
Yeah.
And it's because they just don't train them. So if we know what that number is, we start decreasing that gap between quad strength and hamstring strength. Then now we're building up the posterior chain, which is going to help you pick things up off the ground for as long as you possibly can and as heavy as you possibly can.
A lot of my friends my age are starting to do something called rucking.
Yep.
I've got a good cardiology buddy who he's older than me, and he's rucking and just in tremendous shape.
Yep.
So you recommend that?
Oh, 100%. Because then we think bone mineral density, we're putting extra load other than your body weight on your body. And typically with rucking, it's not like you're carrying around your body weight.
Yeah.
It is
50 pounds
heavy.
maybe?
Yeah. Anywhere 30 to 50 is kind of, a good top end position. Because if it's too much, especially if you're wearing a vest, it's better because the weight is evenly distributed anterior and posterior.
Yeah.
But if you're throwing a backpack on, like, good Lord.
So you like the weighted vest
I
the
do.
best?
I do. Just because, one, it's not pulling you back. So then you're going into hyperextension. You're not getting any core engagement, putting more stress on the lumbar.
Yeah.
So I like just being stacked, body, over your center of mass and base support, and you just go.
So those vests are equal weight front and back?
Yep. They've just got, it's almost like a tactical vest, and they've just got these weight plates. Like the one I have at the house, I think is 15 on the front and 15 on the back. So it's a total of 30 pounds.
When you first see a patient, do you assess their gait and their posture?
Yes.
I think posture is a thing that really breaks down on a lot of older people.
Yep. Well, and
the forward neck,
Yeah.
and the kyphotic
Rounded
thoracic
shoulders.
spine. And
Yep.
what do you do for that? Well, how do you do that? So you assess them and
Yep.
you get them to consciously think, hey,
Mhm.
you got to think about the way you're sitting in a chair.
Yep. Walking. So one of our gold standard, and this is something that we can test over time, is the wall angel test. So you'll just sit on the ground, so with your butt up against the wall, and then elbows at 90 degrees and shoulders at 90 degrees. Then from there, you're just going to try to be here and touch not your knuckles, because you just do like that and touch it, but try to touch the back of your wrist. And then you try to press overhead. Now, if you're not able to do that, you're lacking external rotation. So it's a range of motion issue. That could be from T-spine, your thoracic spine, so here up, or it could be from your shoulder complex in general. It could be a strength thing. So to answer your question, we would go mobility first. We've got like a 3-legged bar stool. So we got to have the range of motion to get in range first.
Mm-hmm.
If you've got the range of motion, then we can stabilize it, resist force. And then we've got strength where we can exert force. So we've got to approach it in that stepwise progression.
I love that. You know, I just thought of something. We ought to have a sprint clinic for older adults.
That'd be awesome. Yeah.
I would love to see
Mhm.
that, because not many people think about that, how older people can sprint.
100%.
Um,
And it's about how you set it up and do it safely.
yeah,
That's the
yeah, because you can get hurt.
100%. I can get hurt. And last thing I need right now is a torn Achilles at 32. So, and if you think about, you extrapolate that to professional athletes like Aaron Rodgers or anybody else that's torn their Achilles, typically it's not with a high velocity sprint. It's going to be like they're going to change direction, or their cleat gets stuck in the ground, or say for an older adult, they go to like change direction with pickleball, where tissue tolerance just force exceeds tissue tolerance, and it just pops.
That's
So-
a common injury in pickleball.
It is.
You know, one reason I think, see if I'm right about this,
Yeah.
that so many people get injured playing pickleball is because of a few things. Number one, mostly they're older people.
Right.
Although there's a lot of young people
They're-
who love
yeah,
pickleball.
It's coming up.
But for the most part, the people that overdo it are old people like
Totally
me.
agree.
So the second thing is they're not warmed up. They just
Mhm.
go out there, and in pickleball, it's not like tennis. You really don't move as much.
Yep.
So you're not really loose, and you go out there and you don't have the proper warm up, and you strain something.
Yeah.
What's a
100%.
good warm up for pickleball?
So a thing that we typically go with is dynamic mobility. So we don't do a lot of static
Dynamic stretching, yeah.
Yeah. We don't do a
Always
lot of
the best.
static. I mean, it's not a bad thing. It's just if you're about to perform, you don't need to just stay still in one position. So with that, now if you're going to do that, we do isometrics. And again, it's kind of hard to visualize, but an isometric is where, like, say for instance, I can do an isometric for my bicep. I just resist here and push up as hard as I can to get that bicep
Right,
firing, and then we stretch it. Okay, so same thing goes for hamstrings or quads or anything. We can couple the isometrics in with the dynamic stretching. And again, I need to definitely make a video about this, because it's something that hamstring tightness, a lot of times it's going to, if hamstrings are tight, they attach to the bones you sit on, your pelvis on the back. It'll tilt your pelvis forward and you get the sway back. And then that's just decreasing the ability to build your glutes as well, because your hamstrings are tight. And tightness doesn't mean you always just need to stretch. It could be a weakness thing that they're chronically tight because they're trying to stabilize your lower back. So again, it's, typically when we hear something's tight, we're like, oh, let's just stretch.
Yeah.
Not always the answer.
That's true, because a lot of people are asymmetrical as
Correct.
well.
Yep.
So you look at that and you try to determine, hey, they're very overdeveloped on the right side.
100%.
They've always been right-handed. They've pitched, they've served,
Yep.
tennis, they've shot basketball, they've thrown, and the right side gets overdeveloped.
Especially in older adults, because they've done it for X number of years, right? So one thing you're talking about sprinting prep, one thing that we do for clearance to sprint is single leg counter movement jump. So you're standing on the force plate, one leg on the left, and then you just dip down, jump as high as you can, land and stick. So then you do the other side, and we can compare force outputs, how much concentric, so going up, force you have, and then how much you land, so your landing force. And then we can just basically correlate, you're more powerful on typically your dominant side. Then a lot of times with injuries, it's going to be something that we can track, not just with pain. So pain's going down, that's great, but we're not focused on pain here. Right? I mean, that's part of it. It's why they came in, but we're more so performance, and pain will take care of itself. So then we just look at the progression over time, test monthly, power's going up, pain's going down. Now we're sprinting.
Yeah.
That's kind of the idea.
I love it. And speaking of pain, if you're my age, if you don't wake up hurting somewhere, you better check your pulse,
Yep.
because you may be dead.
Yep. Or not doing anything. Right.
Or not doing
Yep.
anything.
Yep.
And it's
Yep.
so easy to lay around. What is it? Sitting is the new smoking.
Yep.
people sit around too much. I just ordered myself a different chair for my office.
Yeah.
It's actually a ball.
Okay.
And I'm going to just, it's stabilized, but it's actually a Swiss ball.
Yep.
So I'm going to start sitting on that. One of my PAs, nurse practitioner, actually has one, and he sits on it every day at work. And so I was sitting in his, and you have to sit up straight on that thing. You cannot cheat on it.
And you got to activate your core,
Yeah.
or else it's going to be just a noodle. Your spine's going to be a noodle. So I think that's great. And talking about biohacking from before, like that's something, that you can just put in that takes no effort.
Yeah.
You know what I mean? Like no, brain effort. But yeah, I mean, that's one thing you can do. Sleep is going to be something huge. I know you talk about that a lot. That's something that as a 32-year-old with a son and my own business, I don't get a lot of. So I'm starting to prioritize that a little bit more.
You have to.
Yep, for sure.
So many young people they get in, myself included, when I was young. I mean, I know I had terrible sleep habits, and it really came into play later on. And I've biohacked everything with my sleep in the last few years. I mean, I've tried everything. I track it with my Sleep 8 bed, of course, my Aura Ring. And it's really interesting how different things work differently. So you can try different things. Some supplements. I mean, I'm a big believer in supplements because you should take advantage of it.
Oh yeah. They supplement a good diet, and they need to be in there. I mean, that's the way I feel about it. And by the way, I'm on your creatine and then the superfood.
Oh my gosh, creatine with the HMB is a good combo.
Yeah, I'm actually trying to talk my wife into doing the creatine for just cognitive benefits. A lot of studies coming out now.
I think every adult should be on it. I mean, there's no reason it's not going to harm your kidneys either.
No.
And if you put the HMB in with it, hydroxymethylbutyrate, it helps you burn fat while building muscle. So that's been a good thing. I know. Why would you not? Nobody thinks about that.
Yep.
So your TriStar Strength and Rehab is really doing well. Yeah. I follow your blogs and all that, and your website's incredible.
Thank
you are good friends with my son Ben, who's an athlete and a fitness nut as well. So longevity and fitness, it's so important. You're actually the one that turned me on to measuring how long somebody can do a dead hang, which I find very beneficial for people's shoulders.
100%. Getting overhead.
About 80% of people have impingement syndrome on their shoulders that have problems my age. So if you just hang there from your chin-up bar for a minute, and actually it measures your grip strength too. And I actually bought a few of those grip meters.
Yeah, they're good.
We measured those. So that may be the best measure of how long you're going to live is your grip strength.
Totally agree. And so whenever we're talking about like how we test older adults when they come in for longevity evaluations, grip strength, isometric mid-thigh pull, which is also grip strength. So the bar's set in a rig that's not going to move, so bolted to the ground. The bar's here, I say 3, 2, 1 pull, and you pull as hard as you possibly can. And I mean, there's music blasting, like I'm screaming, it sounds intimidating. But it's meant to be high intent driven. So that's our strength. And we've got certain numbers, and it breaks you off into gender and then age. So we want to hit certain metrics. Then we do jumps, and then we just do it depends on, the situation, but we could do, glute strength, we could do hamstring, quad, like we test everything.
I can't wait till you have your next little soiree. I want to definitely come to that.
Sure.
You got anything in the books planned for that?
So not yet. We're still negotiating as far as that goes with the facility, but we actually do have a 6-week challenge coming up for longevity. So the idea is that the first, you do a down payment as far as the 6-week program goes, and then we track all these metrics on the first visit. And then if you improve all of your metrics, so you'll get some money back.
Oh, that's awesome.
Is the idea. So you put your money where your mouth is, and then you improve, and it kind of fuels you. But yeah, it's 6-week challenge, and just kind of look out on social media, on Instagram and Facebook.
Be like, have you thought about doing something for age, like anybody over 50 come, so that older adults may not be intimidated by the young people in there trying to do the same thing?
That's the idea, is making that just for adults, for all of your people, and then all the other older adults that we train. We're going to kind of have phases to where there's more sport specific testing for the 6-week challenge, and then there's like a longevity division, and we basically got like waves of people that are coming in. So yeah, it won't be like an 18-year-old baseball player, with a 70-year-old adult. So
I love that. I'm going to get you out to talk to some pickleball players.
Love it.
And we'll do another podcast on this.
Yeah.
Josh Davis, thank you so much for coming.
Thank
we'll
you.
do it again, and I'll be
Awesome.
out at your place soon.
Yep.
Hope you guys learned something. We'll see you again next week.
Thanks.